The subject of my talk here at the IBSA Foundation meeting was on sexual arousal, sexual response, and how we measure sexual arousal, and actually also the link between the body and the mind in determining sexual arousal. So I'm a clinical psychologist, and I have also a laboratory, where we study sexual response. And we are actually interested in the psychological components of sexual arousal and sexual response. So what we do in our sex lab at Porto University in Portugal is that we measure both genital arousal during exposure to sexual material and subjective arousal, which means that we have actually two dimensions that are very important. One is the genital, so erection in males, and lubrication in females. And the other one is what we call the subjective, the mental arousal, which is obviously self-reported. And one of the main issues and most interesting issues is that those two dimensions, so genital arousal and subjective arousal, are not exactly concordant always. Of course, they are concordant to some extent, but what is most striking is there are actually a great amount of in a great amount of situations, they are not exactly concordant, meaning that women can be aroused genitally, but they might not be aroused mentally. And the same may occur with men, although in a less extent. So these findings are very consistent across studies in different cultures, in different laboratories. We use those two ways of measuring sexual response. So this is one important aspect, that sexual response is not only genital, it's of course also mental, and these two dimensions are not exactly always quite together with each other. So the other issue, the other aspect of my talk was what exactly predicts this sexual response? What predicts sexual arousal from a subjective point of view, and what predicts physiological arousal? And our studies are very interesting, saying that our cognition, so our thoughts during, in this case, exposure to sexual material in the lab, but we can also think about how this translates into the real life, so into sexual experience and sexual activity with a partner. But in the lab, what we can say is that the best predictors of subjective sexual response, meaning predictors of pleasure, arousal, excitement, as self-reported by men and women, are the cognitions and the emotions. In other words, sexual thoughts and positive emotions were the best predictors of sexual arousal, so subjective arousal. But on the other end, those thoughts and those sexual thoughts and positive emotions were not exactly the best predictors, or they did not predict as well genital arousal, which led us to think that these two dimensions are of course interrelated, but they have may have also different paths. So how can this be translated to clinical implications? So we know that for men, of course, there's for a long time, since the late 90s, the PDE5 inhibitors, Viagra, Cialis, and so forth. And what we know is that, of course, they have a direct effect on genital arousal, so they will make erections more easily. But on the other hand, we know that we can also enhance sexual arousals and sexual pleasure by using a different path, which is the cognitive path. So what we are now trying to do in our laboratory, in our research group, is also try to see the effects of cognitive behavior therapy, which is a psychotherapy aimed at changing or enhancing sexual cognitions in this case, and enhancing sexual arousal from a subjective point of view, and also positive emotions. So what is most interestingly for the future is to see how medication on one end could increase and make better genital arousal, but on the other hand, how could we also improve sexual health, sexual arousal, and sexual satisfaction by using psychotherapy only? So at this point, just to finalize, we are actually conducting a study comparing the effect of PDE5 inhibitors with the effect of psychotherapy, cognitive behavior therapy, in the treatment of men with ED. And what the preliminary findings are telling us is that both treatments are effective in increasing genital arousal and erectile function. They might work by different paths. That's the next question we are trying to guess. But this is the take-home message will be that there are different ways to increase sexual satisfaction and sexual arousal in men and, of course, also in women.